A person suffering from hearing loss has a small chance to be able to react as quickly when, for example, an alarm sets off. Hearing loss. The degree of hearing loss can vary from slight to profound. Hearing loss is broadly classified into 3 types: conductive, sensory neural, or a mixture of them. Conductive means the problem lies in the outer or middle part of the ear. Sensory neural means the inner ear, especially when the hearing nerve cells stop working properly. Hearing loss is among the most common healthcare burdens. Its incidence in newborn babies, called congenital hearing loss, can reach 20 cases per 1,000 births in some countries. Similarly, presbycusis, or hearing loss in people older than 65, happens to almost 40% of the population. The conventional hearing aid can help patients with a lesser degree of hearing loss by amplifying the incoming sound. But in other cases, hearing aids cannot help. Cochlear implant. To help people with near to complete deafness, the nerves, along with the parts of the inner ear, need to be stimulated. In the past, some scientists had experimented with inserting electrical rods or wires into the ear, with patients reporting bubbling or chirping sounds. However, the main pioneer of cochlear implants is considered to be American otologist Dr. William House, who in the 1960s pioneered a single-channel device that could assist in hearing and lip reading. Later on, in the 1970s, Dr. Graham Clark from Australia improved the design and introduced a multi-channel intracochlear device that allowed patients to hear without the need for lip reading. Many improvements have been made since then, such as on the battery life, Bluetooth, waterproofness, and the quality of sound. Currently, there are some established companies already creating cochlear implants, and many countries have also created their own original cochlear implant prototypes. Mechanism. The cochlear implant consists of an outer unit that is worn by the patient and an inner unit that is surgically implanted. The outer unit, consisting of a microphone and transmitter, converts sound into a coded signal, which is transmitted through the intact skin of the scalp to the receiver of the internal unit using a radio-inductive link, just like a mobile phone signal. The receiver converts these signals into electrical output, which is transmitted to the cochlea via the electrode array. This causes stimulation of the auditory nerve fibers and perception of hearing. This way, the cochlear implant bypasses the non-functioning hair cells of the cochlea. The cochlea is tonotopically organized, which means that different parts of the cochlea are better suited to detect specific frequencies of sounds. The electrode that is placed into the cochlea is, in fact, a group of individual wires, each ends at a contact point along the silicon casing. They stimulate different parts of the cochlea as per the frequency of sound. Hence, the more channels a cochlear implant electrode has, the better the perception of sound and speech. In the next video, the criteria to decide whether an implant is needed by a patient will be discussed.